as paramedics, we just like to get the job done, and we're used to doing the job and the next job and the next job, and it's unpredictable. We're used to that unpredictability. We're okay with something coming up. One moment we're supposed to be doing a respiratory emergency, all of a sudden there's a cardiac arrest. So we're quite flexible in our approach, which in primary care, whilst it is often scheduled, patients come in and haven't booked for things that they need. And I think one of our strengths as paramedics is that we're like, yeah, we can work out how we can fit that in and help to improve the efficiencies, which also means the patients are having to come back and rebook for a different day, particularly with the ageing population. Hi, I'm Alecka Miles and I'm a lecturer at Edith Cowan University. I also work as a paramedic in a multidisciplinary team at Dianella Family Medical Centre in Metropolitan Perth in Western Australia. People have been working in community paramedic type roles for quite some time. In Australia, the first program started with a jurisdictional ambulance service in 2007 in New South Wales, quickly followed by South Australia in 2009, and over in Aotearoa, New Zealand, Wellington Free Ambulance also started in 2009. Outside of the jurisdictional setting, people have been working in private sector, in primary healthcare type roles for over 35 years. So this is not new. I work as a paramedic within the multidisciplinary team here at Dianella Family Medical Centre. The role came about after I inquired about doing some benchmarking on how paramedics could fit into general practice in Australia. And I was lucky enough to be introduced by our dean, who is a general practitioner at this clinic. The role started in 2020 after COVID lockdown, when I came to do some education benchmarking to see how paramedics could fit in for my postgraduate course that I teach at Edith Cowan University, and that led to a job offer. Unbeknownst to me, there was some skills such as cannulation that I had as part of my training that was quite useful in general practice, particularly as things were pushed away from hospitals and into primary healthcare in the community. So iron infusions were something that had traditionally been done in hospitals, and not all nurses can cannulate. So I had a skill that was on offer. And I spent some time working alongside the nurses and the GPs in the treatment room, also going out and doing community health assessments for over 75s, which is an amazing experience. Going into people's homes is my bread and butter as a paramedic. So I certainly was able to offer some insights of how we could be more efficient and the things to look for to help support these patients, because it's what we do as part of our ambulance role as well, going into people's homes. And it's just been a wonderful team and learning experience. I've really expanded my scope into things that I never thought I would end up doing when I first started as an ambulance paramedic too many years ago to care to say. But it's something that I still find I'm learning every day, and it's a really great position to be able to balance the emergency and urgent care type experience with the people who are predominantly chronic disease practitioners and that more generalist role, as well as the nurses. So it makes for a really great team having everyone working together. We know that paramedics have been working in a variety of roles, both in jurisdictional ambulance services and outside in primary healthcare contexts. But as I said, we don't have very much information on what they're actually doing, which is where this project came about. So full disclosure, I am immersed in working in primary healthcare context, having worked in general practice for 4 years. So I do have an insider view, but I do acknowledge that bias and try and park it when I'm doing my research. So the aim of this part of my project, of my PhD, is to examine the attributes and practices of paramedics working in primary healthcare contexts in Australia and Aotearoa, New Zealand, and to describe their demographics and characteristics. The model is, I guess, unique to this practice, and it's one that, I guess, in community paramedicine, it's really important that we're serving the needs of our community. And for me as a paramedic in this practice, my role is to fill the needs of what's needed on any day that I'm here. So I have a patient list in the treatment room, the same as what the nurses do. However, if there is any urgent care or emergency that occurs, then I'm usually the first port of call. We're really lucky we've got a second paramedic working here now as well. So most days of the week there is a paramedic on shift, and we are always the first port of call for that emergency or urgency, which is great. And surprisingly, there has been lots of sick people that come into general practice. One of the things that has worked really well in the multidisciplinary team is that there is a great crossover of skills. So there's lots of things that all of the clinicians here are capable of doing, and everybody's really aware of people's strengths and uses those strengths. So it's a workplace where egos are sort of put to the side, and if you know that there's someone in the clinic that has more knowledge or skill in an area, irrespective of what your professional registration and title is, that person is called upon to contribute to the patient's care, because we're really working on trying to be patient-centred in our care at the clinic and holistic. We've had quite a few emergencies, and one of the first, I think, efficiencies that we worked on as a team was for me to support the practice as to what the paramedics who are coming to transport the patient to hospital need. So making sure things like paperwork with medications and allergies and their past history, giving them a good outline of the observations and treatment done. Lots of times when I've worked in an emergency ambulance, we've turned up to general practices and there's a patient that's got active chest pain who's just waiting in the waiting room for the ambulance to come, but no one's actively treating that chest pain, and more often than not, that person is having an acute myocardial infarction, so they need to be treated urgently. In this practice, often the paramedics that come to pick up our patients are complaining that we've done all the things before they got there. So I think that that's a wonderful thing, and they can keep complaining about that we've done too many things for the patients and they don't get to do them. I think that's fabulous. And I think just the teamwork that has evolved, having the three different perspectives of clinicians from medicine, nursing and paramedicine, is really amazing for patients' ongoing care, because we all come looking at it from different perspectives, which means things don't get looked, biases aren't always as present as they can be when you're focused on your own profession, because you've got different people challenging that, or what if this, or what if that, could it be this, oh, I saw this and this was what happened. So that is another, I think, great thing for our patients, and our patients appreciate that, and we can very capably handle any emergency situation, whether it's a cardiac arrest. We've had a child come in who was having active seizures at the time, and that ambulance service 3 weeks later ended up asking them to come back to the clinic because they couldn't get an ambulance for 20 minutes, and they sent them to us to manage until the ambulance could come and transport that child to hospital. And both times we did an amazing job, but it happened to be the same day and the same time of the day, and the same clinicians were able to treat that patient a second time, and the family's relief. They were not from Australia. It was very stressful for them. English was their second language. We didn't speak their native language, and no one in the clinic on that day unfortunately did. So their angst was quite a lot, as you can imagine, when your 6-year-old's really unwell. But the second time when they came in and saw the familiar faces and knew that we'd done the best we could for their child the first time, was fantastic for us to see their relief, and it just made that second time go so much smoothly. It was just like a simulation with a mannequin, was how calm the situation was, because everybody had been there in that situation before, and we knew what we needed to do, but the patient's parents knew that they were getting the best care and we were going to look after their child. As we know, their GP on the day appointments are very few. Having the paramedics here also means that if their GP is okay with it, which you are when we're here, they can come in, we can give them an assessment and work out what it is that they need, work with their GP to get that, and then treat them at home. Alternatively, if it is a serious issue, we can also triage that over the phone and recommend that they call an ambulance, which we have two ends of the spectrum with people. For all health consumers, we've got people that are wanting to go, not sure and think they should call an ambulance, and you've got other ones that really do need to call an ambulance, and we have to work really hard with them and their families to help them understand that the treatment that they need is actually in an emergency department. Alternatively, we've got the other patients who might have a simple skin tear that traditionally would get an ambulance call, but they can call up and we can assess that and usually keep them here and treat them in the community rather than sending them off to hospital. It's hard, I guess, as the clinician to talk about the outcomes, because personally, for me, an outcome has been in increased knowledge of the health system, primary healthcare, really great understanding of what GPs do, their capabilities, learning more about what different nurses do, because as a paramedic in an ambulance, the only nurses that you really interact with are the ones in ED, and their scope of practice is very different to a nurse who works in primary healthcare and a nurse who works in aged care. So there can be, I guess, some misunderstandings of the capabilities and expectations of nurses, not understanding that it's actually okay that everybody's got different skills in those different areas because they're skilled to what they need for that area. The outcomes, if you ask Julie, our practice manager, she says that there's been more efficiency. I think as paramedics, we just like to get the job done, and we're used to doing the job and the next job and the next job, and it's unpredictable. We're used to that unpredictability. We're okay with something coming up. One moment we're supposed to be doing a respiratory emergency, all of a sudden there's a cardiac arrest. So we're quite flexible in our approach, which in primary care, whilst it is often scheduled, patients come in and haven't booked the things that they need. And I think one of our strengths as paramedics is that we're like, yeah, we can work out how we can fit that in and help to improve the efficiencies, which also means that the patients are having to come back and rebook for a different day, particularly with the ageing population. There's quite an older demographic in this area that we work. So I really like to make sure that if a patient's coming here, they get everything that they need for the next however many months till they need to come back, so they're not having to come back every couple of weeks for an injection if they could have it today when they've come for something else to get a new script filled and those sorts of things. Having a second paramedic is great. Obviously, I have another role in education, and our new paramedic, Mark, who's not really that new anymore, he's here for more days of the week. I'm lucky enough to get to work with him on a Friday, and it's great having another paramedic around, and we certainly notice that it just works in a really great team sort of way, and there's a lot of trust and understanding of everybody within all of the health professions that work in here. We even have a community pharmacist that's just started this year, and that just brings another dynamic. Even though we've got the pharmacist next door, it's so great to be able to have our patients' medications reviewed. It's wonderful for us, for our learning, to be able to go and ask about the medications that when we don't know a lot about, or new ones that we haven't seen.